for letting me talk today. I'm going to kind of go down two roads. First, a little bit about what I do, because everybody goes, medical librarian? You guys all know that our librarians exist, obviously. I would hope, since you're sitting in a public library. And technically, we all have the same degree, but we go into other areas of the field. So there are also like legal librarians, obviously academic librarians, who often have a second master's in the specialty that they are the academic librarian. So I also have a second master's in information systems because it very much aligns with what I have to do, because I actually work from home behind a computer, and I am not in a physical library and haven't been for over a decade. So I work for a large healthcare organization that is in this area. I have worked for their competitor in the past. And so my job is to really work with our physicians, nurses, and other clinicians, our leaders, to work on topics that they have. So they may be publishing, they may be trying to answer a clinical question, they may be trying to do some performance improvement, looking at the quality of care. And so what we do is we formulate and execute complex search strategies, and we use a variety of information resources and customized search outputs. Our major one we use is PubMed, which is funded by the National Library of Medicine, which is part of the National Institute of Health. So it is a government database that is free to anyone. It doesn't matter whether you're a librarian or a researcher. We also teach nurses and other care providers about evidence-based research, how to search, and how to evaluate those articles. And then kind of some of the behind-the-scenes things that we do is we select and acquire and purchase all of the resources that they may need to use. Because most people say, oh, it's free on the internet. But when it comes to medical information, it's not. It's a multi-billion-dollar business. These publishers like Elsevier, Science Direct, some of these big ones you may or may not have heard of, it is quite costly to purchase these. So hospitals and other entities have to invest heavily, academic institutions. And when things moved online, it got even more costly for us. So one of our things is to make sure we're buying the things that are needed, because we don't need children's books in the hospital. So we're buying the things that make sense for them to use. Though the children's hospitals do have children's books, and many of the children's librarians will actually go out and do story time in the hospitals. Well, they're librarians, so they still like to do story time. I do not do story time, nor have I ever done story time. I did do a stint for about 8 years in the public library system. In fact, I used to be a public librarian here when I was pregnant with my daughter, who's 20. I used to work for Stockton Public Library. I now sit on the board of trustees here at my public library and have done that twice, back when my daughter was young, and now again. So I still keep my knowledge up in both areas. We also promote scholarly communication and assist clinicians and researchers in picking the best journal to publish in. One of the things is when you do research, you want it to be seen. And you want it to be seen in a journal that people are actually reading. So we look at what journal aligns best with what their topic is, and then we help them to figure out how the best way is to publish in it, because you have to follow the rules of each journal. They each have different requirements, and they each have a different way you have to cite your citations and all kinds of little technical things. So we help our, especially our residents who haven't published before, we spend a lot of time with them, helping with that, because they've left their academic institution and they still need that support. So to give you a sense of the type of questions we answered, these are just things I made up. They're not exactly things I've been asked, but they are very similar. And I didn't pick any of the hard pharmacy ones because I would then have to try to say the drug name, and that's not going to happen because I can't spell it or say it. So I picked some easier ones. So we may have someone come to us and they're doing some research and they're looking at the CPAP machines that you wear when you have sleep apnea. And they're trying to find out whether or not they are being non-compliant, meaning not wearing it, because of adverse childhood events. And adverse childhood events could be things like they lost a parent, they had a really bad disease as a child, all kinds of things. So they're trying to see if there's a reason that this correlates. Another question would be, they're looking for academic research related to physician burnout. As you can imagine, physician burnout happens, and certainly during COVID, it was a really big issue. So they were looking at, are there ways to help physicians incorporate the 6 pillars of lifestyle medicine, which is healthy eating, physical activity, and it's something that they then also might discuss with their patients. So if we can get them to use it, then they're more likely to talk about it. And it helps with chronic diseases. Or can we use wearable technology in the hospital setting to help monitor how our patients are doing? How would that work? What it would look like? So wearable technology could be like a smartwatch, but there's other also technologies that they may use that work specifically for health reasons. So I'm just going to give you an idea of what a search would look like. So this is the lifestyle medicine one. This is only the first half of it because I'm not incorporating what the physicians are doing. This is just the search of how I'm looking for the information to capture lifestyle. So the first part where you see the word mesh is the subject heading. So think of like similar to Dewey Decimal or like Library of Congress subject headings. But these are specific to medicine, so they're very granular. So you can see lifestyle or healthy lifestyle or health promotion. So a lot of Boolean logic. I don't like Boolean logic. and if you get one or one and, or one not, or one adjacency wrong, your whole search is crap. And so you're building this, and many times we're building these just like in Notepad, almost like you used to program, and then you're executing it in the database because you don't want to stick it in the database because then you can't tell what you did wrong. So this is what PubMed looks like. And then just at the bottom, it's like very complicated if you don't want animal studies. So you have to tell it, no, I don't want animals, but I don't want animals and humans, because if you say I just don't want animals, it will cut out every study that has animals and humans in it. So you have to not it, right? So this is what it looks like in PubMed. This is what it looks like in specifies for nurses. This is the cumulative index of nursing and allied health. And so you can see I took that same search and I have to change it all because it doesn't translate. I have to translate it. So this is what we do all day. 60% of my job when I'm not leading my team is building these very detailed searches. So we tell people, oh, we'll do a literature search for you. They're like, huh? Well, what is that? So this is our way of showing that this is what we would do for you. And so if they're going to publish something like a systematic review, and we'll talk about what those are a little bit later, this has to be exact and it has to be reproducible. So that means any other scientist or librarian who goes in and copies it out of paper from New England Journal of Medicine has to be able to go into the same database, re-execute it, and get the same results, or the study is flawed. So mostly academic librarians are helping these. Each college usually has a librarian that specializes in it. But at the large healthcare company I work for, yeah, that's that. Nowhere, or Southern, or somewhere else. Yeah, okay. Let's see. So one of the things obviously we talk about a lot is our physicians are trying to help our patients understand what they're reading in the news. So I just took a snapshot of one day of what I found about diet on the internet. And I only used Facebook and Google. If I had gone to TikTok or anywhere else, I would find another thing. So if you ever want to notice what cheese hands are, be prepared for the pictures. Low-carb diets may increase colorectal cancer risk. Mediterranean diet may help women live longer. And these are all news items that may or may not come from reputable places, particularly when you see something like Vitality Health Matrix, sponsored. Or a very interesting news place that isn't ABC or CNN. So this is just an example. You can only imagine if you put other things into it, what this does. And so the problem is that everyday individuals, they read and absorb this information, they see it on social media platforms, they talk to their friends, but they don't have any evidence, as we talked before. They just kind of absorb it and take it in and drink the tea, right? So one of the things we try to teach is health literacy. And so health literacy is like kind of understanding how do things make it into the literature, how do they make it into the news, and how do I interpret it for my purposes, for my needs, my health, my family's health. So one of the questions is like, well, how does it get into the news? PubMed indexes 1.9 million articles a year that are published in medical journals. So only a fraction of that makes it to the news. And sometimes the fraction that makes it is the things that they think are either going to have an impact in the future, or if you're a person writing the news, you think that I'm going to get headlines and someone's going to read this. So it's not always actually the things that people need to hear about, it's what they think they want to hear about. So sometimes they come from academic institutions where they're trying to keep their funding. So the researcher will write an abstract or a news release, a PR news release, so that the news people will pick it up. So that's one way. Sometimes there's aggregators who put together packages of articles and then send them out to the news entities so that they can pick those up and publish them. So whether we like it or not, research is really a young researcher who's trying to make a name and trying to get tenure and trying to make sure that they can study. It is about getting eyes on their paper. And so news media is one way to do that. But the problem is that literature and research articles are very hard for the average person to read. We're not trained in it unless you go to school or become a researcher yourself. So you have to be really careful. So one of the things I always tell people is, okay, you saw the news article, but what is the actual study behind it? See if you can go find that study and actually read it. Because in the news item, they're talking about, oh, this was the great result. But they don't talk about any of the other things about, like, what population should it be applied to? Was it only done in seniors and you're 20 years old? Maybe this doesn't apply to you. Was it only done in a country where they have different medicines available? We don't have those here because they haven't been approved by the FDA. So there's lots of reasons those articles may or may not apply to your situation. It doesn't mean they're bad science, it just means they're not applicable. So I do encourage people to go and find the study. One of the great movements that's happened recently is what we call open access. So in the past, every journal study was usually behind a paywall. You couldn't get to it. So people were complaining, well, we all pay our taxes, and then the NIH funds research that's done in universities, but then we, the people, cannot read the studies that were done because they're behind the paywalls of these big journals like New England Journal of Medicine or even smaller journals. So there's been a movement that they all need to go open access. So it's our tax dollars that pay for the study, we should be able to read it, which is great. But because of that, there's been some journals pop up that are called predatory journals, and they don't have an editorial board. They are just a scam to make money. And so they will name themselves similar to well-known journals. They will put editorial people on their board that those people don't know they're on the editorial board, and then there's no peer review. So that means the article has not been looked at by a peer, another physician who's an expert in the field, or a panel of editorial and experts to make sure that what they're publishing is well written, that the results are shown in the correct way, they're not changing the information. So there are a lot of articles out there that are just false or they haven't gone through the process. So the physician publishing it may not be doing it for nefarious reasons. They're doing it because they need to get their research out there, and they don't understand that they just put it in a predatory journal. So you just have to be really careful. And so that's one of the things we teach about a lot also, is how to identify and see, like, who is this journal? Is it indexed in PubMed? How long has it been around? Who's on the editorial board? Because there's nothing worse than you publish your dissertation and find out you put it in a journal that is not reputable. Like, that's the kiss of death as a researcher, that you just spent years and years on this. So really important. So with health literacy, it's an interesting thing because you can be one of the most literate people in the world. You can have a PhD in something, but in a time of crisis when you're sick, all that goes out the window. You're looking for something to find a way to better your health or the health of your child or your parent. So in the research that was done, only 10% of adults have the skills needed to use the health information that is routinely available from their doctor or in retail places or in the media. So that's 90% of people who read something and don't know how to use that health information and determine whether it is reliable or not. And personal health literacy is the degree to which individuals have the ability to find the information, understand it, and use information services to form their health-related decisions for themselves and others. So it's really an issue. This is a while back, but the Department of Education did some research back in 2003, and they said that only 12% of Americans were considered proficient in this skill. So it's something that as medical librarians, we try to go out and teach, and particularly ones who specialize in consumer health. So one of the things is that words are used differently by the public versus scientists. So, for example, theory. Like if we say, oh, I have a theory that so-and-so this. Well, we're just speculating, right? It's like a hunch. I think my dog is sick because, but I don't really have any, it's just a theory. Or I have a theory of why he doesn't like peanut butter. I don't know. Like, so it's not explained. But in science, when someone says I have a theory, like quantum theory, or the theory of relativity, it's because it's a broad explanation that's been rigorously tested, and it's supported by multiple lines of evidence, and has, you can predict it. So it's hard because when you're trying to translate, if you don't understand that a theory is a very scientific thing when you're talking science, but it's just a hunch when you're talking as a regular individual, it skews how you interpret things. So it's important to understand when you're reading that an opinion is just my opinion. It's my opinion about something, but as scientists, when it's an opinion, it's an insider interpretation, which is grounded in expertise and based on evidence. So it's just knowing kind of the difference between the terms and how they're used. So a study was done, and like a good librarian, I cited everything, back in 2023, about when most adults are uncertain whether health misinformation items are definitely true or definitely or definitely false. And so you can see these were some statements that were made to individuals around reproductive health. So like sex education, that includes information about contraception and birth control, increases the likelihood that teens will be sexually active. Even if people felt they knew it was true or false, you can see they falling like, it's probably false. Very few knew whether it was definitely true or definitely false. So even if you feel like you can interpret it, it still creates uncertainty. So even when they don't believe the false claims they hear, it's complicated, and public health is complicated. So learning to be more health literate and adapt and understand things is really important. So we saw the CRAP test before, and the CRAP test can be used in science also, not just for websites. So same thing, and I like this one because it kind of lays it out like, these are like hard stops. Like if you can't answer these questions, this is probably not something you should be reading. All the way over to green lights. So, we talked about lateral reading and using the CRAP. This is really important because if you don't know who the author is, if they're not an expert in the field, even if they're a physician and they're talking about a specialty that's not their own, so you should be mindful of that. Like if a cardiologist is talking about brain surgery, that's not necessarily the expert in the field. So, or if you have one who's on TV who's a general medicine person and who's just randomly talking about really specific health topics, they're not always the expert in it. So even within that, you should be cautious. And be sure that the source isn't intended to sell something. If they seem incorrect, are they not supported? Have you found other citations that just doesn't seem like it meshes up to that lateral reading? And so then the green light is it's recent, it has information about the latest advances and ideas, the author's known and it's an expert in the topic, the facts are correct and backed up by citations and other sources, so you're really looking to see, is there enough information on this to make a good decision? The problem with some of the stuff that comes out in the news, it's the new stuff, so there isn't anything else. They're still on the cusp of it. They're trying to figure it out, and they've made a breakthrough maybe in the science. But there's not enough to move forward and say this is how we should apply it to the everyday person. So the other big thing is you should see, like, am I reading news, or am I reading advertising, or am I reading a study? So there's this great website from the National Institute of Health about how to find and evaluate online resources. So you're looking to see, does it endorse a product? Because really normal news organizations won't do that. It only quotes people who say good things about the product. It contains links to the sales site, and it only includes positive reader comments. So, and you aren't able to add a comment of your own because they don't really want to hear any feedback. So it's really important to kind of look for those things. So if you suspect that your news site is fake, you should look for a disclaimer somewhere on the page. It's often in small print, often hidden, but it will indicate that the site is an advertisement because they're required to say that, but they usually hide it. So look for that, because then you'll know you're looking at something that's being advertised or sold. So with a bit of detective work, and that's what I say I love most about my job, is every day's a treasure hunt. I never know what I'm gonna find. I also never know what pictures I'm going to end up looking at. Not always the best. I've seen some things I never want to see again. But hopefully you all run into those pictures. So you search for websites of well-known health institutions, so maybe like Mayo Clinic, Cleveland Clinic, some of the really big ones. They usually will have really good health information that is written at a level that they feel most people will be able to understand it. So unfortunately, you know, the reading level in the United States is mostly somewhere around the 6th grade level. So they're trying to make sure they boil down the information into that area. There is a really good website called medlineplus.gov that is part of the National Library of Medicine. Fortunately, there's probably been some changes to it lately, but it does still have some good information on it. You can, and then you should look at who wrote it, who reviewed the content. Are they doctors, nurses, RNs? Not that they're infallible. There are definitely doctors and nurses out there that don't always use science to make their decisions. But you should look for the editorial policy. The policy can tell you where the site gets its content. Look for those scientific references, backtrack them, see what they say. Just because they cited it doesn't mean it's real, so you want to go find it. No matter where you find the information, make sure it's not old. Be careful of chat rooms and discussion groups because they are not reviewed or regulated. And plus it may come from people who are not experts or who are trying to sell you something. So if you read something in one of those, go find the scientific evidence behind it, see what someone else says. And then don't just rely on one website. Compare the information you find. So, you found that study, and it looks daunting because it's 17 pages long and it's got graphs and charts and things you don't know how to read. But there are some things you can ask yourself when you get that study to be sure. So you've got this study from the New England Journal of Medicine and you're reading it. So you're going to ask yourself, well, what are they trying to answer? Who funded the study? Now, funding is interesting these days, and most studies come out of academic institutions or from the NIH. But drug studies are often sponsored by the drug companies, and there's a reason for that. They're the ones who have the money to do the studies. So it doesn't inherently mean that the study is bad. It just means you need to pay close attention to what were they testing the drug on, who were they testing it on, and what was it for. Now, a lot of drugs are used for what they call off-label use. It's not the drug, what it was approved for. It doesn't mean it doesn't work for that, right? Pharmacists in the audience. So it doesn't mean just because they're using it off-label, but it will be harder to find studies. But you may find case studies and talks about it so that you can kind of see, are other people using it for this reason? How do the findings fit in with previous studies on the topic? Are there other studies that have confirmed the idea, or is it new and untested? What questions still need to be answered? And a really good study will tell you at the end, these are the things we still don't know, and we need further research on this. Because they're only usually looking at one very specific thing. How many people were in the study? Did they study 15 people or 1,500 people? The larger the amount of people in the study, the better, usually the better the outcomes and the results, because you have a better picture of what's happening. Who do they apply to? Was the study done only in certain groups of people? Do those groups of people match who you are? And what questions, like I said, I did a double, sorry, what questions still need to be answered. So this is what we call the evidence-based pyramid. So these are the levels of evidence. On the right-hand side, you'll see the different types of studies. Starting at the bottom is the lowest level of evidence, which is what we have the most of. So expert opinion and background information. This is a physician who may be writing an opinion piece. It could be a book chapter in a book. And we work our way up. As we work our way up, the study has a higher level of quality. And you'll see the bottom half is unfiltered. This means it's the original study. It's the randomized controlled trial. It's a cohort study. And the top three are, they're taking the information from the bottom four and analyzing it and putting forward a review or a meta-analysis. So systematic reviews are only done on certain topics. There's more and more of them happening, but what they're doing is taking all of the literature that may have been written about a particular science, maybe diabetes, and comparing the studies so that they can average them out and see, is there really an impact over time? We usually try to find this stuff for, like an everyday person who really wants to read the study. Obviously, physicians who get rare diseases, they're having to look down at the lower level, because case studies, it takes a while before anyone's going to study it. And some rare diseases only happen in so many people, so all we have are case studies. So they'll use those case studies and look at several of them to see if they can figure out what might be going on with their patient. Okay. This is just a little different one. This is one that's used for nurses. Part of the reason for nurses is they use both quantitative and qualitative studies, and the reason for that is some of the stuff that they are studying, there isn't a way to do a quantitative study on it, so they'll do qualitative, so they'll do surveys or ask people questions and then do studies from that, or they'll do like a quality improvement project and see what the impact was to prevent falls in the hospital or something like that. So they use different levels, but it's kind of the same thing, and you'll see there's non-research evidence and research evidence. So not the most exciting topics in the world, but it's really important because you need to know what kind of studies are out there in order to make sure you're reading the right study type for what you're trying to find out. So if you're trying to find out how do I prevent this disease, then you need to look at randomized controlled trials or cohort studies where they follow two different sets of people. Maybe it's nurses who smoke and nurses who don't smoke, and they follow them over time. So those are important, particularly for like the prognosis of the disease. The only way we're going to know how it's going to change and impact the person over time is to follow them. So they'll follow people with it and people without it in a very controlled way. And of course, randomized controlled trials, many of the drugs, this is how they do the drug trials. One set of people get the drug, the other set don't, and they look at the impact. Or one person gets the surgical procedure and one person gets the drug, and they compare how they came out at the end, which one was better. So it's really important to understand, I'm looking for this is the type of study I would end up seeing that should be studying this. Because if they do the wrong type of study for the question, the results won't make any sense. It won't be applicable. So if you're gonna ever try to review a study, there are critical appraisal tools, and each one you can see they match the type of study. So I'm looking for, a diagnosis or a randomized controlled trial, and if I use this tool, it will walk me through what questions should I ask. And these are free online at CASP, Critical Appraisal Skills Program. There's others, these are free. So you can go through and say, did the study address a clearly formulated research question? Yes, no, I can't tell. Was the study designed to assess the outcome of an intervention? Who was the population? What were they given? How was it measured? If it's a randomized controlled trial, which this is what it's for, it's really important that the interventions were really well randomized, where they double blinded so the researchers don't know what's going on, because any time you don't do it correctly, then it skews how they may interpret the results at the end. And so they ask, and so there's another sheet to this. They go through the list so that you'll be able to kind of look for that information. So it really helps you to evaluate that even as a layperson. But there's a lot of layers to this, and so this is why we end up with misinformation and disinformation on the internet and TikTok, people being paid, is because it's really hard to take a 13-page study and boil it down. And so you only get snippets and pieces, and they're only picking the pieces that further what they want to sell or what they want to purport or what they're getting money back for. So I know that was a lot of information in a short time, but it just was a sense of like what goes into it. And so since we have so many people right now who don't trust scientists, part of it is because they don't know how to read the science. And if we were to increase people's health literacy so that they were asking questions and being skeptical and being critical while they're reading something or doing further research and not just taking that meme at face value or that TikTok influencer at face value, we may not have some of the stuff that's going on right now. So it's just really important to think about it. And there are medical librarians around, so you all know one now. So, you know, if you have any questions or can't interpret something, by far I'm not a clinician or a pharmacist or any of those things, but our specialty is getting to that information and finding the information so that we can give it back to those physicians and nurses and make sure that they're reading the latest evidence. Yeah, sometimes they really do have to go all the way back into the 30s for some of the stuff, particularly the case studies, or even what fabric is best for a mask, because like it was studied during
That's right.
right? Like we use masks for other plagues, so we do a lot of research into, well, what fabric would be best for that, and that is in the literature if you go back, because it's something we've done for years. So the history of medicine is important. For us as laymen, looking at the most recent stuff is the best thing to do. But when you are a researcher or a physician, you have to look at the totality. You can't only look at the most recent stuff because you may miss something. There's a case a long time ago at Johns Hopkins University where they had a really bad drug reaction in a patient. And they had found if they had asked the medical librarian to do the research, they would have found a case study that was in the print and not in the online world, that would have kept them from giving that drug. So it really, you know, there's no way physicians can keep up with 1.9 million articles a year. No one could. So part of having other specialists is having someone who can bring that information together so that then they can read it for the science. I'm not interpreting it, I'm not a physician, but I can pull together the most applicable information so that they can spend their time treating the patients and then review that. So it's just kind of just another part of the medical world that people don't think about. So I thank you for inviting me to speak about it. I'm really passionate about it. There's a reason I've done it for 25 years. I'm really horrible at trivia because I do not have an English background like many librarians. I have a BA in speech pathology and audiology. So yeah, when the subject is books, famous poets, I'm not the person you want on your team. And everyone's like, oh, we got a librarian here. Yeah, no, I didn't take that in college. So thank you, and do you have any questions? I know that was a lot, and I can never talk slow. This is why I'm no longer a speech pathologist.
And I think if I'm looking at the time right, we have about 10 minutes or so for questions. So first, show of hands if you have a question for Eve. 1, 2, 3, 4. I think I saw I had 5. Great. How about back in the corner over there?
What was that last source of information you mentioned, CPAS?
Yes, CASP. The URL is casp-uk.net. This is out of the UK. But they are one of the ones that put them up for free, so it's a really useful site. We use it every day to teach people how to evaluate.
That was a quick one. Jay.
Two-part question. Do you use AI in your practice? And the second part is how to react to people who say, you know, you showed me these queries, but I can just type that into ChatGPT in natural language and I'll get my answer. Why do I need you?
Sure. Well, that's what they said about the internet when it came out. They would need librarians, and we're still here. So technically, we don't use AI in a formal way. We do know that PubMed is using AI in the background to help index some of the articles. And they're trying to make PubMed usable by the regular user, but also powerful enough for the researcher. So if you do use just like some keywords, you just stick words in, it uses an algorithm to try to find the correct subject heading, to look for the text words. So in that way, we're using it at this point. The other caution I give to people with AI, particularly people who look at a list of articles from someone asking, hey, can you get these articles? And we're looking at it all and going, come back. Did you use ChatGPT to get your list of articles? Because these are hallucinations. They don't exist. So in particular, ChatGPT is really bad at hallucinating articles. So really bad if you're trying to find research to put on Wikipedia and you use ChatGPT and it's giving you made up crap. And so we've had to go back to doctors and research and say, this is made up. These aren't. Do you really think there's 10 studies in the last year on this topic? Like, really, there's not. So we're incorporating it, but we're cautious with it. And I still think a powerful researcher who knows how to use Boolean logic and understands how an index in a database works will outsearch AI anytime, because AI can't understand the nuance of the question of the researcher, which is what we call a reference interview. We ask the really pointed questions. What are you using this for? Are you is it a clinical thing? Are you writing a paper? Why do you want this? Because the information we get back will look different. So,
Good question.
Hallucinations.
That's a good point.
That was the two-part, right?
Yep.
All right. Karen.
So, this may be a loaded question, but how does the current budget cuts impact access to our medical information?
Sure. So right now, we haven't seen a major change in PubMed. If we do, it will devastate the research community, because this is the mainstay of how we keep track of what's published in all these journals. And it happens to be funded by the NIH. There are other databases, but not for health information, that are as powerful. And if there are other ones, they often use the data that comes from the NIH. So that's one way. An impact we have already seen is the National Library of Medicine has regional medical libraries. One of them based out of the University of Washington. They lost all their funding last week and cut all of their ability to go out and do this work. And so they go to public libraries and teach the librarians about health literacy. They produce materials that can be used by researchers. They're really the laymen out trying to help with information usage and knowledge, and it's gone. 9 librarians gone overnight. And that's just 1 out of 9 regional medical libraries that I can say for sure it's gone. So that's the health information side of it. Medline Plus, which is by the NIH, is still up and running, but we've seen language changes so that it's harder to find the information. For us, bringing down of the CDC information was devastating. Because we're looking at the CDC that has things like vaccine, how you're supposed to give it, what regimen, at what time, along with a million other things that are used by physicians every day. So we've shown them other ways to find it, but it has been an impact. Since we're standing in a public library, I'll take the time to answer what the impact to the public libraries have been. So the Institute for Museums and Libraries, the IMLS, was defunded. That means that the state of California now no longer gets $15 million that they used to get from the IMLS. That $15 million is spread across public libraries to help with things like summer reading. So they would produce all the materials and the public libraries would use it. It takes away money that used to fund high-speed internet access in very rural parts of the state of California. So that means now, if there's no phone lines to Social Security, there's no Social Security in 100 miles office, the place they went was the library to go sit down and use the computer and get some help with how do I get access. So we got a letter from the state of California yesterday about the impact. The state of California used to fund the New York Times for every public library. It'll be gone. Those are just like 3 examples I can think of off the top of my head. And if you're trying to get to health information, you need access to a computer. It's not easy to get any other way. So it's daunting.
We may have time for one more, so raise your hand if you still had a question. Oh, okay, we got one more in the back, yeah.
Thank you for being on the board.
Oh, you're
yes.
welcome. We are fighting hard to be sure that we still have a really great library here in Lodi. And so far, so good.
All right, we're gonna take just 2 minutes to do a tech swap, and then we'll have our next speaker.